following portion of Bloom is sponsored by Orthopedic Medical Group of Tampa Bay.
Welcome back to Bloom. Tennis elbow doesn't just affect athletes. It can affect nearly 3% of adults each year. So what is it and how do you treat it? Joining us to discuss is Dr. Bryan Butler of Orthopedic Medical Group of Tampa Bay. Doctor, welcome to Bloom.
Great. Thanks for having me.
So explain to us exactly what is tennis elbow. I think I've had it before and it's really painful.
Well, it's very common, as you just said. The official term is called lateral epicondylitis, which is essentially an unhealthy tendon that starts at your elbow and goes down to your wrist. So here on this model, this is called the epicondyle, and it's a tendon that goes from the elbow down to the wrist. So people who get it when they do a lot of repetitive use with their wrists, either typing, lifting, weights.
Okay.
And it's basically an unhealthy tendon that has failed to heal properly.
Okay, and so what are some of the symptoms?
Well, first and foremost, there's going to be tenderness right here on this area. So if you're pushing around your elbow and you feel tenderness there, that's the hallmark. Number two is nighttime pain. You're going to get it at the end of the day. You're going to get soreness, aching, fatigue. And the third thing is you're going to get pain when you use it. So anytime you're lifting or using your wrist a lot, you're going to get the tennis elbow symptoms. So
does it require surgery, or are there some conservative treatments that you can do? And if so, how long does that recovery take?
Well, good question. Well, 90% of people can get better without surgery.
Okay.
So that's good. The odds are in your favor. The first things we would do is offer you some anti-inflammatories, just to help with the pain and the inflammation. Second thing we'd offer or tell you to do is activity modification, which is a fancy term for just if it hurts, don't do it.
Okay.
But a lot of that is in how you lift. So if you're used to doing things with your palms down, we'll tell you to keep with your palms up or thumbs up, and that will take the pressure off the tendon.
Okay.
If you're really in bad shape, we'll offer a cortisone shot, and that will help decrease the pain. But that leads to the next step, and this is the most important step, and that's physical therapy.
Okay.
Also, you can mitigate the symptoms by using this. This is called a tennis elbow strap. You put it on your forearm, and there's a little bubble, and it goes right there, and basically it takes the tension off and the pressure off the tendon where it's hurt.
So let's say I think when I got it, it was from lifting weights.
Yes.
I would use that while lifting weights.
Exactly, but the most important thing to do would be to do therapy.
Okay, good to know. Now, let's just say you've tried everything that you've mentioned and none of it works and you do need to turn to surgery. What does that look like?
Well, there's a procedure you can do and then there's surgery. Now, one of the procedures we offer are biologic injections. So that's either your plasma or a stem cell. That's been shown to be about 80% effective. We would take some sort of blood product from your body and spin it down and inject it into the area. And that's been shown about 80% effective, but it could take up to 3 months to get better. But if that doesn't work or you wanted to bypass that, there is a surgery. And the surgery is about a 15 to 20 minute surgery where we make an incision right over the area. We actually clean out or scoop out the unhealthy tendon and reattach the healthy tendon. Again, it takes about 15 to 20 minutes, and you're looking at about a 2 to 3 month recovery time.
But I think it's really cool that you assess each patient individually and that you do offer so many treatment options before you even get to the surgery.
Correct. Our goal is to be most minimally invasive possible with the maximal effect. So if we can get patients better without surgery, that's our #1 goal. But if it requires surgery, then we have good outcomes with that.
And you offer the physical therapy at your office?
We do. We have 3 physical therapy offices. They don't necessarily have to go to ours. It's got to be convenient, but therapy is key. Even after surgery, therapy is key. So if you really want to get this better, you need to do the therapy.
Doctor, thank you so much for joining us. I know this is going to help a lot of people watching right now, so I appreciate you, Dr. Butler.
Great. My pleasure. Thank you.
And for more information on Orthopedic Medical Group of Tampa Bay, visit their website at omgtb.com. That's omgtb.com. We'll be back with more Bloom right after this.
The preceding portion of Bloom was sponsored by Orthopedic Medical Group of Tampa Bay.